The factors that make a high-risk pregnancy a lot of times is either a maternal pre-existing condition such as hypertension, diabetes, any other kind of medical problem. Also, like the number of actual babies in a woman's uterus, whether it be a multiple gestation like twins, triplets, history of prior deliveries like preterm birth and that kind of stuff, or else fetal indications like babies with birth defects like cleft lip, cleft palate, spina bifida. Those kind of are what I would consider more high-risk pregnancies. Prenatal care through a high-risk pregnancy will involve more visits with usually a specialist other than your primary OB-GYN, which is called a maternal fetal medicine specialist. A lot of times you'll get more blood testing, you'll get more antenatal testing as far as like sonograms, maybe what are called non-stress tests. It might impact your route of delivery just for the fact that if you have a medical indication, it might be your pregnancy gets ended a little earlier and you don't get the option of waiting for spontaneous labor. The main signs and symptoms I would want to be aware of during a high-risk pregnancy would be preterm contractions, abnormal swelling, headaches, blurry vision, symptoms of high blood pressure in pregnancy, abnormal fetal movement patterns, and anything really from my brain that concerns you, you can bring up to the attention of your doctor and they can at least make sure that's normal for your gestation. As far as stress and anxiety goes in your pregnancy, first and foremost, you got to know that stress and anxiety will have no impact on your growing baby. It might make you feel miserable, so the normal techniques you normally would use to alleviate your stress and anxiety, whether it be exercise if it's allowed from your provider, or like say reading a book, watching a movie, taking a hot bath, whatever tends to help you relax and feel less stressed is what you should probably pursue. Some of the changes a woman can expect after she delivers are many. First and foremost is what we call the postpartum blues, where you feel kind of sleepily depressed, easily tearful, overwhelmed, which usually lasts about the first 2 weeks of pregnancy. Bodily changes are many as far as, sluggish bowels. Sometimes you have hemorrhoids that develop after delivery, pain from an episiotomy if you happen to have stitches. Skin changes as far as coloration goes, from like anything from your areolas to lines on your tummy. Those are probably the majority of them, but our nursing staff here is set up to kind of help screen you and get you through those blues if needed.